It's a tremendous privilege to be with you today, and I think that it's important for us to acknowledge some truths. It's truth that all communities have health issues and outcomes that they're not pleased with. But it's also truth that the health disparities that exist amongst our ethnic communities are far exceeding what exists in the majority community. And the very fact is that we die from the same conditions that others walk around with decades for. And the reason for our stark reality with regard to mortality is simply because there is just not enough access to care. There is not enough coordinated care within our community, and our community is found on the short end of the stick. When resources are moved around, we are the last to receive any resources. It's a privilege to work with GBUAHN and the safety net doctors who have formed GBUAHN to change these realities in our community so that we can have improved outcomes, so that our babies can live beyond infancy, so that elders who have chronic illnesses can have them managed instead of seeing their health deteriorate before our eyes. It is a tremendous privilege to work together to improve the health of this community. And I cannot tell you in enough terms how important it is for us to shoulder together, to lock arms together, and to work collaboratively to eradicate these outcomes. And I promise you that we are capable. I said it earlier today, that if an achievement is done by human beings, it's not superhuman, it's human. And if it's a human achievement, we're human beings, we can achieve the same outcomes, and we must work together to make that the reality for every member of our community, young, old, tall, short, fat, skinny, no matter what the circumstances are, we can improve our outcomes, and we are committed to work with GBUAHN and with the safety net providers in GBUAHN and with the downstream partners to change that reality in our ethnic communities. Thank you so much for allowing me to be with you.
At this time, we would like to acknowledge one of our community members, Shaniqua Tubbins. She is in attendance today, and she shares with us that through her membership in the GBUAHN Health Home, she has been linked to several health and social resources and has seen an improvement in access to health care for herself and for her 1-year-old son. So we just want to salute our member, Shaniqua Tubbins. At this time, we want to acknowledge our partners in attendance. You've already heard from the Greater Buffalo United Ministries, United Ministers Council, the Baptist Ministers Conference of Buffalo, New York and vicinity, Western New York Independent Living, and Jewish Family Services. Thank you for coming out and for sharing with us on this day. At this time, we will hear from Reverend Ted Howard, pastor of the Edison Street Community Church of the United Ministers Council, who will be followed by our CEO of GBUAHN, Reverend Raul Vazquez. Health disparities.
Reverend the doctor.
Certainly, we are thankful to be connected and in collaboration with GBUAHN. I pastor a church. Not only do I pastor a church in one of the highest areas, zip code 14215, where we have the highest level of HIV, highest level of diabetes, high school dropouts. And what we're finding, even in our services, that we're finding people who serve as greeters and ushers who are passing out, who have had some medical concerns, and that we've had to address them only to find out that the reason they have succumbed to them in the middle of service while we're worshiping God, amen, that they cannot afford prescriptions for their health issues. And so we're excited that we're able to partner with GBUAHN that there will be a bridge for us to lead our parishioners and the community that I pastor in. I just don't pastor in 14215, I live in 14215. So I can walk to the church 5 minutes from where I live. And so I'm right in the middle of that health disparity. And so we're just looking forward to right now, we're in the process of starting a health ministry in our church. One of our members is a parishioner, one of our parishioners is an RN who's gone through some training, and we're looking through that to develop a health ministry that will help us not only to impact the church, but also be an intermediary where as we go out into the community and evangelize, because we want to win their souls to Jesus, but we also want their bodies to be preserved for Jesus. Amen. As they come and they walk into health. So we're excited about this collaboration and the relationship. We're looking forward to it, and I cannot wait for the next time that we're able to have this kind of meeting where we can begin to talk about the results of collaboration. God bless you. Thank you.
Reverend Raul.
As a member of the Minority Health Council, one of the things that the commission is interested in doing is listening to the community to find out how we make changes. And it's important. Let me just tell you, Latinos make 20% of New York State, African American 18. Between the two, we make 40% of the state. So they're listening in a lot of different ways. But I think that the biggest thing that we're trying to accomplish with this whole process is the state has been looking at different parts of, of the area where there's large Latinos, African Americans that are not achieving the kind of health care that they should be getting. And so with this committee, and I'm sorry, things that I think was important was they looked at 44 areas in the state to look at how bad it gets. And I've got to tell you, unfortunately, Buffalo ranks 1 to 2 out of 44 areas in New York State. This has been the sort of the process. This has always been the case here in Buffalo. And what we're trying to do at GBUAHN is really try to change that. Because I feel that the work that GBUAHN is doing with the pastors, with the scholars, with the community is very important. And I think that this is a start. So we're going to have the Commissioner of Health come here and listen to the community. And I'm hoping the community has good solutions to the problems that we face. I mean, we're facing conditions of diabetes that are killing our market. HIV is killing our market. I mean, I could go on and on. But when I came here 25 years ago, we had the same problems. And now 25 years later, I'm hoping to have an impact. And that's the work that you guys do. And that's the work that we're trying to accomplish. And I'm hoping that by having this listening session, as a community, we can come up with some good solutions. So thank you for coming today. And amen.
Amen.
I'm so glad that Dr. Reverend Vazquez came and gave us those words. At this time, we're going to ask if Jessica Molina would come and share, Mohammad, Safi, and Nehzat, who is a PHN. They will come in that order.
Good afternoon. Reducir la desigualdad en la salud debe ser un trabajo de todos, de la iglesia, de los doctores, de nuestro gobierno, pero especialmente debe comenzar por nosotros. Así que acepte el reto. Reducing health disparity has to be a job of everyone. Not our churches, our doctors, our government, but most importantly, it begins with us. Accept the challenge. Thank you.
Good afternoon, everyone. حالات صحی بهداشتی ضعیف، شرایط خراب زندگی و دسترسی ضعیف و کمتر به تداوی پزشکی کمک میکند تا یک شرایط ضعیف و ناتوان ایجاد شود. من اعتقاد دارم که با هم و با کمک شرکا و با رهبران جامعه میتوانیم فلوی ضعیف را به فلوی بزرگ تبدیل کنیم. Poor health and poor living conditions and poor access to medical treatments help to create a poor environment. I believe together with the help of our partners and community leaders, we can change poor Buffalo into a greater Buffalo. Thank you.
All right.
امروز اینجا جمع شدیم برای اینکه همه مراقبت‌های پزشکی لازم رو دریافت کنند. امروز همه با هم متحد شدیم که بر علیه بیماری‌هایی که شهر ما رو غلبه کرده است بجنگیم. امروز ما از شما می‌خواهیم که با این چالش روبرو شوید و نقش خود را به نحو احسن انجام دهید. Today we stand on common ground for everyone to receive good health care. Today we unite as one to fight against the diseases that plague our city. Today we ask you to accept the challenge and do your part.
About many of the health disparities that plague our community, and one of them is mental health. So at this time, you're going to ask the Jewish Family Services, if Ms. Marlene will come forward and share with us.
Good afternoon. I am Marlene Schillinger. I'm the CEO of Jewish Family Service. On behalf of the board, staff, and most importantly, the people that we all serve, we are honored to be represented today. One of the things that's really important to me and we serve is behavioral health and the stigma associated with behavioral health challenges. There is always something in the newspaper where people are doing something bad who have a behavioral health challenge, whether it's mental health or substance abuse. There are far more people that are living, and I say living, with mental health challenges than those people that are out there through no fault of their own doing some negative things. So stigma is something that is really important, and we would like to join forces with all of you to ameliorate. The other thing that's really important for us and has been a really exciting piece in working with GBUAHN, the docs, and the other downstream providers is really having an opportunity to integrate physical and behavioral health. We know that there is a relationship between people who have a physical challenge, whether it's diabetes, heart disease, or some other really serious problems, and their mental health and well-being. So we pledge to work with all of you to move this issue forward. Thank you very much.
We also would like to acknowledge the Alzheimer's Association. Thank you for coming. And we want to say save the date for Turn Up Buffalo, a conversation on health, which will be held on May the 16th at Bennett High School, 5/16/15. It will be co-sponsored by New York State Minority Health Council and GBUAHN Health Home. We thank everyone for coming and have a great day.